The emergency room was a symphony of controlled chaos, a place where silence was often a sign of trouble. A patient had just arrived with symptoms of a routine respiratory infection. The medical team was moving fast, following the standard procedure with practiced efficiency. In the back stood Sarah, a rookie nurse on her second week. While the senior staff focused on the primary diagnosis, Sarah noticed a tiny rhythmic twitch in the patient's left eyelid. She hesitated, then stepped forward. "Wait," she whispered. "Can we check the glucose levels again?" The doctor stopped. 15 minutes later, the entire room went silent. What had she really seen? The air in the Metropolitan Hospital ER always smelled of a mixture of harsh disinfectant, cold recycled air, and the metallic tang of unspent adrenaline. It was a high-pressure environment where every second was calculated and every person had a specific, rigid role. Sarah moved through the hallways like a shadow, her soft-soled shoes barely making a sound against the polished linoleum. As a rookie, she was the person who brought the water, changed the linens, and recorded the vitals that the monitors had already captured. To the veteran doctors and senior nurses, she was helpful, but essentially invisible. Just another set of hands in a room that required 100. The neon lights overhead hummed with a low-frequency buzz that most people ignored. But to Sarah, it felt like a countdown. She felt the weight of her inexperience every time a senior doctor brushed past her without a glance. In this world, seniority was the only currency that bought respect. "Sarah, I need these charts organized by priority," the head nurse, Mrs. Higgins, said without looking up from her screen. Her voice was as sharp as a surgical blade, honed by 30 years of witnessing life at its most fragile. "Yes, ma'am," Sarah replied softly, tucking a stray hair behind her ear. That was the extent of her influence. She was a pair of hands, not a voice. In the hierarchy of the ER, seniority was equated with accuracy. If you hadn't been there for 10 years, your intuition didn't carry much weight. Sarah understood this, but she also had a secret weapon. During her clinical rotations, her favorite instructor, a woman who had retired after 40 years in the field, had taught her one thing. "Don't look at what the machines are saying, Sarah. Look at what the body's trying to hide. Machines measure the state of the room, but the skin tells the story of the soul." On this particular evening, the ward was at capacity. The sound of coughing, the beep of heart monitors, and the frantic murmurs of worried relatives created a wall of noise. An elderly man named Mr. Henderson had been brought in. He was coughing, slightly feverish, and seemed confused, his hands wandering aimlessly across his blankets. To any experienced eye, the initial assessment was straightforward. A common viral lung infection complicated by mild dehydration. The team moved in with the mechanical grace of a pit crew to start the IV and administer the standard protocol. Sarah stood at the foot of the bed, her clipboard held tight against her chest, ready to assist with the linens or the water pitcher. She watched Dr. Aris, a brilliant but hurried resident, as he checked the patient's breath sounds. Aris was efficient. He had 3 other trauma cases waiting in the next wing: a car accident, a fall, and a suspected stroke. He was looking for the big bad, the catastrophic failure that required immediate intervention. When he didn't find the crushing chest pain or the facial droop, he moved to the next logical, safe conclusion. But Sarah wasn't looking at the lungs. She was looking at Mr. Henderson's hands. She noticed the way his fingers were drumming against the side rail. Not in a nervous or bored way, but in a strange, irregular pattern that looked almost like a code. Then she saw it. A tiny rhythmic twitch in his left eyelid that happened exactly every 6 seconds. It was so subtle that the harsh overhead lights almost washed it out. She felt a cold flicker of memory. During her final year of school, she had sat with a patient who had similar micro-signals. Everyone thought that patient was stable, a routine recovery case, until he slipped into a deep, irreversible coma within an hour. It wasn't the lungs or the initial injury that killed him. It was a metabolic storm, a silent chemical cascade that no one had bothered to check because the obvious problem was so loud it drowned out the truth. The internal conflict was a heavy, suffocating weight in Sarah's chest. Part of her wanted to stay silent, to be the good rookie who didn't cause delays or ask stupid questions. She didn't want to be the girl who questioned a senior doctor in a room full of people who were already exhausted. She didn't want to be wrong and be the joke of the break room for the next month. But as she looked at Mr. Henderson's glazed eyes, eyes that seemed to be looking at something far beyond the hospital walls, she realized that being right didn't matter as much as being careful. She saw the team preparing the transport papers, getting ready to move him to a secondary ward for observation. Once he was moved, he would be checked once every 4 hours by a revolving door of staff. If she was right, if the twitch meant what she thought it meant, he wouldn't last that long. He would be gone before the next shift change. She took a deep breath, her heart drumming a rhythm of its own against her ribs. She knew she was about to cross an invisible line, a boundary of ego and protocol. She knew that in 15 minutes, she would either be the fool of the ER or the person who saw the truth through the static. The team was about to unlock the wheels of Mr. Henderson's gurney, the metallic clack of the brakes echoing in the bay. "All right, he's stable enough. Let's get him up to the 4th floor," Dr. Aris said, already clicking his pen and turning to walk toward the next trauma bay. He didn't even look back at the bed. "Wait," Sarah said. The word was small, barely more than a whisper, but in the sterile, high-tension quiet of the bay, it sounded like a thunderclap. Dr. Aris stopped mid-stride. Mrs. Higgins paused her note-taking, her glasses slipping down her nose. 2 other interns, who were already halfway out the door, looked at Sarah with a mixture of annoyance and genuine surprise. "Is there a problem, Sarah?" Mrs. Higgins asked, her voice carrying the cold, hard edge of someone who didn't like her workflow interrupted by a beginner. Sarah walked closer to the bed, her legs feeling like lead. Can we double-check his blood glucose and maybe run a full metabolic panel before he goes upstairs?" Dr. Aris sighed, a long, weary sound, and checked his expensive watch. "Sarah, we already have the intake labs from the ambulance. His sugar was 110 40 minutes ago. It's a textbook reading. He has a viral lung infection. He needs rest and fluids. We need this bay for a high-speed collision victim coming in by ambulance in exactly 4 minutes. We don't have time for redundant testing." "I know," Sarah said, her voice trembling slightly but remaining steady. She forced herself to look Dr. Aris in the eye. "But look at the eyelid twitch, and look at his skin. It's dry and parchment-like, despite the IV. I think the initial lab might have been a fluke. Or maybe his chemistry is shifting faster than the infection." The air in the room became thick with an uncomfortable tension. It wasn't a toxic tension, but it was the heavy weight of social hierarchy. The expert had given his verdict based on data and years of training. The rookie was asking for a delay based on a feeling in a twitch that no one else had even noticed. "We don't treat feelings or hunches here, nurse. We treat patients based on evidence," one of the interns muttered, loud enough for Sarah to hear, his tone dripping with condescension. Sarah didn't look at the intern. She stayed focused on Dr. Aris. She didn't argue with her degree. She didn't cite a textbook. She simply pointed to Mr. Henderson's hand, which was still drumming that irregular, ghostly code. "It will only take 2 minutes to do a fingerstick. Just 2 minutes. If I'm wrong, I'll do double overtime for the rest of the week, ma'am. I'll clear every tray in the hospital." Aris looked at Sarah. He saw the genuine, raw fear in her eyes. Not fear of him, but fear for the man in the bed. He was an arrogant man at times, a product of his own success. But he was a doctor first. He looked back at Mr. Henderson. The patient was sitting there, looking relatively stable, but the eyelid twitch was there, a tiny rhythmic signal in a sea of normalcy. "Fine," Aris said, throwing his hands up in a gesture of surrender. 2 minutes. But if it's 110, Sarah, you're clearing the trauma bays and the supply closets for the rest of the shift. Don't waste my time again." Sarah didn't wait for him to finish. She grabbed the testing kit from the cart, her fingers moving with a frantic precision. She pricked Mr. Henderson's finger. The man didn't even flinch, which sent another chill down Sarah's spine. A healthy person should have felt that. The room was silent, save for the hum of the computers, as they waited for the little plastic device to count down. 5, 4, 3, 2, 1. The screen didn't show a number. It blinked a single terrifying word. High. It meant the levels were beyond the device's ability to measure, well over 600 milligrams per deciliter. The atmosphere in the room shattered like glass. The dismissive looks from the interns vanished instantly. Mrs. Higgins dropped her clipboard, the paper fluttering to the floor. The efficient machine of the ER shifted gears with a violent, focused intensity. "He's in DKA," Eris whispered, the arrogance replaced by a sharp clinical terror. "Diabetic ketoacidosis. But he's not a known diabetic. There's nothing in his history. How is that even possible?" "It's the infection," Sarah said, her voice finally losing its tremor now that the truth was out. She was now fully in her element. The stress of the virus triggered a latent response. His body is literally burning itself up from the inside. He wasn't confused because of the fever. He was confused because his brain is starving for insulin. Mrs. Higgins didn't wait for orders. She was already grabbing the insulin protocols and shouting for a second line. The interns who had been mocking Sarah were now scrambling to get more equipment, their faces pale with the realization of how close they had come to a disaster. The routine lung patient was suddenly a critical metabolic emergency. Sarah felt a strange, hollow mix of relief and terror. She had been right, but being right meant that Mr. Henderson was in much more danger than anyone had realized. If they had moved him to the 4th floor, he would have slipped into a coma in the quiet of the elevator. He would have died in a darkened room while everyone was treating a cough that didn't matter. The pressure was no longer on Sarah. It was on the team. They had to stabilize a man whose internal chemistry was spiraling out of control. But as Sarah helped secure the new lines, she saw Dr. Eris looking at her. It wasn't the look he gave to a rookie who needed to stay out of the way. It was the look he gave to a colleague who had just prevented a tragedy. The tension was still high, but it had fundamentally changed. It was no longer about ego or seniority. It was about the 15 minutes they had almost lost. And as the monitors began to beep with a new, urgent frequency, Sarah realized that her voice wasn't just a sound. It was the only thing that had stood between a patient and the silence of the grave. The next 15 minutes were a blur of coordinated activity. The team worked with a new kind of precision, a meaningful, quiet urgency. There was no more shouting, only the rhythmic exchange of data and the steady movement of hands. They administered the insulin, adjusted the electrolyte fluids, and monitored the blood gases every few minutes. Slowly, the high reading on the monitor turned into a number that the machines could understand. 550, 480, 410. Mr. Henderson's breathing, which had been labored and rattling like dry leaves, began to smooth out. The eyelid twitch stopped. The strange, erratic drumming of his fingers settled into a calm, natural rest. He opened his eyes, and for the first time since he entered the hospital, he looked truly present. His gaze found Sarah's face. Where am I?" he asked, his voice raspy, like he had been screaming for hours, even though he had been silent. "You're in the hospital, Mr. Henderson," Dr. Eris said, his voice unusually soft, his hand resting gently on the man's shoulder. "We're taking care of you. You're going to be okay. We just had to fix a little chemical imbalance." The crisis had been averted. The lung infection was still there, but it was no longer a death sentence. The metabolic storm that had been raging in his blood had been calmed. The team began to disperse, moving back to their other duties as the trauma case from the highway, the high-speed collision victim, finally arrived. The ER returned to its usual roar, but the energy in the ward around Sarah had shifted. People were moving a little slower as they passed her. They were looking at her as she cleaned the equipment, their eyes filled with a new kind of curiosity. Dr. Eris stayed by the nursing station for a moment, finishing his notes with a steady hand. He looked up as Sarah approached to return the testing kit. He gestured for her to come over. "Sarah," he said. He didn't use the word nurse or rookie. He didn't even use a formal title. He used her name. "Yes, doctor? I've seen DKA 100 times in my residency," Eris said, leaning against the counter and rubbing his tired eyes. "I've seen the fruity breath. I've seen the deep, gasping breathing. Henderson had none of that. His presentation was entirely atypical, a medical anomaly. What really made you speak up? It wasn't just the eyelid, was it?" Sarah took a moment to find the words. She looked at the busy ER, at the people rushing past with their own burdens. "It didn't match, sir. Everything the machines were telling us. It didn't match the rhythm of his body. He looked like he was fighting something that wasn't the infection." I remembered a case from my training. The instructor said that sometimes the body talks in a whisper before it starts screaming. I just, I didn't want to wait for the scream. Eris nodded slowly, a look of profound humility crossing his face. I almost moved him. I almost let my own rush and my own schedule blind me to the details. I was looking for the big picture, and I missed the life in front of me. Thank you, Sarah. Truly, Sarah felt a sudden, hot flush of warmth in her chest. It wasn't about the praise, she didn't need a medal. It was about the respect. She realized that she had earned something far more valuable than a high priority on the shift list. She had earned the right to be a witness. As the night progressed, the story of the rookie's catch began to spread through the ER like a quiet fire. It wasn't a miracle story of a super doctor. It was a story about the vital importance of not staying silent. It was a story about the value of the person who is standing in the back, watching the things that the experts are too busy or too certain to see. A senior nurse, a woman who had been particularly dismissive of Sarah earlier in the week, walked past her and squeezed her shoulder firmly. Good job, kid. Keep your eyes open. We need people who look at the skin, not just the screen. The soft twist of this story isn't just that Sarah saved a life. It's that the life she saved wasn't just Mr. Henderson's. She saved the team from their own dangerous certainty. She saved them from a mistake that would have haunted them for the rest of their careers. She saved the culture of the room. Sarah realized that being a rookie wasn't a weakness or a liability. It was a strength. She didn't have the blind spots that come with 10,000 hours of routine. She didn't have the calluses on her intuition. She still saw the world with the fresh, terrified, and beautiful attention of a beginner. She went back to her work, checking the bins, clearing the trays, and recording the vitals. She was still a rookie. She was still at the bottom of the ladder, but she was no longer invisible. She was the one who saw the details. She was the anchor of the ward. When she finally left the hospital that morning, the sun was beginning to rise over the city skyline, painting the clouds in shades of pale gold and pink. She felt the cool air on her face and realized that she was physically exhausted, her bones aching, but she wasn't tired. She had finally found her voice in the noise, and in the silence of the early morning, she knew that she would never be afraid to use it again. Because sometimes the smallest inconsistency is the loudest truth in the room, and the difference between a tragedy and a recovery is just one person who chooses to speak up when everyone else is ready to move on to the next task. Mr. Henderson was asleep when she left, his heart beating with a steady, healthy rhythm. He would never know Sarah's name. He would never know about the eyelid twitch or the finger stick. But he was alive. And for Sarah, that was all the credit she would ever need to keep her eyes open. The incident didn't lead to a grand ceremony or a plaque on the wall. In the ER, you don't get medals for doing your job correctly, but the ripple effect was unmistakable. The next day, during the shift handover, Dr. Eris did something he had never done before. He paused the briefing and looked at the junior staff. Before we start, he said, I want everyone to remember the Henderson case. We all missed it. I missed it. The only reason that man is upstairs in recovery instead of the morgue is because someone in this room had the courage to tell me I might be wrong. From now on, if you see something that doesn't fit the chart, I don't care if you've been here for 10 minutes or 10 years, speak up. I'd rather be annoyed by a double check than saddened by a mistake. The Elena mindset, Sarah's mindset, began to weave its way into the culture of the unit. The senior nurses started to ask the rookies more questions. What do you see? Does anything feel off to you? Sarah continued her work exactly as before. She didn't act like a hero. She didn't boast in the cafeteria. She remained quiet, observant, and diligent. But she noticed that people were no longer looking through her. They were looking at her. One evening, a week later, Sarah was working with Mrs. Higgins in a different trauma bay. They were treating a teenager with a broken arm. Sarah, Mrs. Higgins said, pausing with the cast materials, you've been looking at his breathing for 3 minutes. Is there something I'm missing? Sarah smiled. No, ma'am, he's fine. I was just checking the rhythm. Good, Higgins replied with a nod. Keep checking. We need more checkers. This is the real power of a one-move change. It wasn't about a policy update. It was about a shift in the human atmosphere. Sarah had shown them that being professional didn't mean being certain. It meant being constantly curious. The soft reveal of this act is that Sarah's catch didn't just save Mr. Henderson. It saved a dozen future patients who would now be treated by a team that was more humble and more observant. The culture of speed over substance had been replaced by a culture of precision through presence. Sarah realized that her value wasn't in her ability to be fast. Her value was in her ability to be still, to be the one who didn't rush past the tiny signal. In a world that is always demanding we move on to the next thing, Sarah's story is a reminder that the most important thing is often the thing right in front of us. The person in the bed, the twitch in the eye, the detail that doesn't fit. As she stood at the nursing station, watching the chaos of a new Friday night shift, Sarah felt a profound sense of belonging. She wasn't just a gear in a machine. She was a witness. And in a place like the ER, being a witness is the highest form of service. The story of the rookie nurse is a mirror for all of us. Regardless of our profession or our position in life, we often think that to make a difference, we have to do something big. We think we need a title, a platform, or a massive amount of power. We wait for the grand opportunity to be a hero while we ignore the 100 small opportunities to be useful. Sarah reminds us that the biggest truths are often hidden in the smallest details. Excellence is not about never making a mistake. It is about having the courage to question the plan when the reality in front of you changes. It is about realizing that every voice in the room matters, from the most senior specialist to the newest student. How many times have you felt that something was off? How many times have you seen a small wrong but chose to stay silent because you didn't want to be that person? We fear being the outlier. We fear being the one who causes a delay. But as Sarah learned, the cost of silence is always higher than the cost of a few minutes of embarrassment. Most mistakes in this world don't happen because people are bad. They happen because people are in a rush. They happen because we trust the system more than we trust our own eyes. Sarah's superpower wasn't her medical degree. It was her attention. It was her refusal to let the noise of the world drown out the whisper of her conscience. In your own life, you may feel like just an employee, just a student, or just a bystander. You may feel that your voice isn't the one that makes the decisions, but you are the one who is watching. You are the one who sees the details that the decision makers miss in their hurry to reach the goal. Don't be afraid to say, wait. Don't be afraid to ask for a double check when something feels hollow or wrong. Speaking up is not about being right. It's about not staying silent. It's about caring enough to interrupt the machine for the sake of the truth. Mr. Henderson is at home today, perhaps sitting in his garden, breathing the fresh air. He is alive because one person chose to be difficult for 2 minutes. What will you notice today? What small wrong will you choose to address? Sometimes the most viral thing you can do is simply to pay attention. One move, total silence, and a world changed because someone dared to look again. Be the person who waits. Be the person who sees. Be the voice that breaks the silence and reminds us all of what truly matters. The biggest truths are waiting for you to see them. Will you be the one to pay attention?